walk immediately into the room and I would look at her straight in the eyes and I would notice that she doesn't appear to have any involuntary movements. If I smile, she smiles. Maybe I would comment about the weather, how long she's been in the waiting room, and maybe notice that she had on a coat or a raincoat, depending upon the weather. I might make a comment about her recent birthday. If all of those questions seem to be answered properly, I would make mention in the notes that she's oriented to person, place, and thing. Then I would give her some kind of a mental concentration test, and for you the test would be if you could take 7 from 100, and whatever number you get, subtract 7 from that. You could start by 100 minus 7.
93. 86.
Okay, that would be enough. And I would say that I would move now on to the head exam. I would notice that her head is symmetrical and that she is normal cephalic with ears that are placed in the middle and appear to be bilaterally placed. Then I would look at her scalp and I would say that she has no dryness, no flaking, no lesions, no secretions, and then I would move on to her ear. And I would say this is the lobe, the helix, the antihelix, the tragus, the antitragus, and this is the mastoid process. And then I would take the otoscope and I would comment on the presence of a gray pearly tympanic membrane with a very small amount of wax and no lesions, no secretions other than that. And the cone of light was at 5 o'clock on that side. And on this side, once again, shiny pearly gray eardrum, no obvious wax, no lesions, no scaling, and cone of light is about 7 o'clock on that side. And then I would move on to the cervical nodes. Preauricular, postauricular, occipital, superficial cervical, deep cervical chain, supraclavicular, submental, and submandibular. And now I'm going to check your thyroid. Can you just swallow? And again. And then I would proceed on with saying that her nose is midline and her throat appears to be midline. And you want to look inside your nose? And your turbinates do not appear to be enlarged. Nasal passages are open and clear. I do not see any distension of the jugular vein. I'm going to move on to your eyes. Your eyebrows are symmetrical. Your eyelashes turn inward. Your lids approximate your globe. No intratropin, no exotropin. I see the inferior and the superior lacrimal puncta. No drainage. I see the palpable conjunctiva with numerous capillaries in the bottom, moist, no drainage. The lacrimal ducts are inside this area here, and they drain into the internal mediatus of the nose. The bulbar conjunctiva are clear. I can see the sclera through it. Now we'll check your eyes for the red reflex. You'll just look over my shoulder. And continue to look over my shoulder. Okay. And now I'm going to look in your mouth. Also, I want to check your pupil size. One thing, sorry. Can you look straight at this light? And I estimate your pupils to be about 4 millimeters in size and bilaterally symmetrical. Can you open your mouth and just say ah? A little bit more and stick your tongue out. Ah. More. Ah. Tonsils, 1 plus, uvula midline. Raise your tongue up. On the bottom, I want to see the bottom. The frenulum allows the tongue to move freely. The sides are pink. No lesions. Palate, nice ridges, pink, moist. Teeth are straight, white. A few cavities on the bottom in the molars and on the top. Can you stick your tongue out again? One more time. Okay. Ah. Big. Okay. And up. Okay. And your parotids, I cannot palpate. Okay? And I'm going to start with the cranial nerves. I'm going to hold something up to you for you to smell. If you'll take one side of your nose and push it in so you can't smell anything by it, and you identify the smell. Close your eyes. Take your own hand and include one side. Take a big whiff. Tell me what it is.
Coffee.
Okay. And the other side? Same thing.
Vanilla.
Cranial nerve number 1, the olfactory nerve. Now the optic nerve is cranial nerve number 2. I would do the 3-finger test to begin with. Tell me how many fingers you see?
3.
Oh, I'm sorry, the 3-finger test. Anyway, you would identify how many fingers I hold up. Also the Rosenbaum, I would give you a reading card, and I would let you hold it 14 inches away from your face, cover up your left eye, use your reading glasses if you could, and you would read to the lowest line possible. And then I would do that for the other eye. And then the Snellen test, I would have you stand 20 feet from the Snellen chart, and I would have you cover up your left eye, testing your right eye first, and you identify on the E-chart the lowest line that you could actually read, and then we would do it with the other eye. So that's those are the tests, and also the confrontation test. I need to test you for that. And if you would actually take your hand and cover your eye, one eye, and I want you to tell me how many fingers you see.
2. 1. 2. 1.
Okay, and that's all part, excuse me, cover up the other eye, of the ocular motor. Okay.
2. 1. 1. 1.
Okay, and the Hirschberg test is part of the ocular motor. I'm just going to get you to look into this. And I'm looking for the pupillary light on the same place on both pupils, and it's present. And I'm going to see if your pupils are equal and reactive to light. And they are. And I'm going to get you to look straight at the end of this. Okay. And also for the ocular motor test, for cranial nerve number 3, I'm going to use the 6 cardinal positions of gaze. Okay? And if you would look straight at me, and when you see the end of this, you say now. Okay?
Now. 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 Now, back in. Now. Now.
Okay? The trochlear is cranial nerve number 4. Cranial nerve number 4, I just need you to look at the end of this and keep watching it with your eyes. Okay? That's cranial nerve number 4. Cranial nerve number 5 is several tests. I'm going to take this little wisp of cotton for the trigeminal number 5, hold it up, and check your blinking. Okay? Okay? Also, I'm going to use something sharp and something blunt. I want you to close your eyes and you tell me whether you see something, feel something sharp or something blunt. Okay? Close your eyes. Just tell me sharp or blunt.
Sharp. Sharp. Sharp.
Okay.
Sharp.
All right.
Blunt.
Okay.
Blunt.
All right. Okay. Open your eyes and clench your jaw so I can palpate this muscle. Okay. Very good. I'm going to check your pulses while I'm here. All right, and I'm going to listen for bruits on your temporal arteries while I'm here. +2, and no bruits. Okay, now, cranial nerve number 6 is the abducens. Just look at the end and follow the end of this with your eyes without moving your head. All right. The 7th cranial nerve, I'm going to make some faces and do some things with my face and you mimic me, okay? Smile, frown, raise your eyebrows, squint your eyes tight, puff out your cheeks. Okay? Another thing that I could do would be to put a taste on the very back of your tongue and allow you to identify that taste. Now, cranial nerve number 8 is the vestibular cochlear cranial nerve. And so I have several tests that I'm going to do. The first one, if I could get you to stand up with your feet just a little bit apart. Okay? All right? And if you'll just stand there because I won't let you fall. Okay? And close your eyes for 20 seconds. All right, open your eyes and have a seat. All right, I'm going to whisper something behind you and you identify the word.
$99.
Yes, okay. Now I'm going to test you with the Weber and the Rene test, the Weber and the Rene test with a tuning fork. I'm going to strike it, I'm going to hold it up to your forehead, and you tell me if the hearing disappears at the same time of the ears or maybe one lasts longer than the other.
It's the same.
Same?
Mm-hmm.
Okay. And now I'm going to do it again. I'm going to put it on the back of your ear, and I'm going to get you to tell me by holding up your finger when the sound disappears. And then I'm going to put it in front of your ear, and you tell me when that sound disappears. Okay, I'm going to do it again on the other ear. Okay. The Weber and Rene were both negative. Now, the next test is the glossopharyngeal and the vagus, and I'll test them both together. The glossopharyngeal is number 9, number 10 is the vagus nerve. And so what I'm going to do is look inside your mouth. I'm going to get you to say ah.
Ah. Ah. Ah.
Okay. And the vagus nerve, and that's the glossopharyngeal and the vagus. And when you say ah, and also the fact that you gag when I put this in the back of your throat. So, and the next one is the spinal accessory, and that's the cranial nerve number 11. So put my hands on your shoulders and ask you to raise your shoulders against my pressure. Yes. And now I'm going to get you to look straight at me midline. I'm going to place my hand here, and you just push against my hand. Rotate your head. Okay? And let's do it again on this side. Okay? And The hypoglossal is the 12th cranial nerve, and I want you to say these words: right, tight, and dynamite.
Right, tight, dynamite.
Okay. And could you puff out your cheeks and stick out your tongue? Okay. All right. Good. And so the next thing I'm going to do is move these things off the table. I'm going to go behind you. Can you pan the room, Steve? Okay. The first thing I'll notice is that you do not have any pronounced hair at all in the back. Your spine is midline. Cervical, thoracic, and lumbar curves are present. You have normal color distribution, some freckling, some moles, and your shoulders are equal on both sides. What I'm going to do is I'm going to check you for kidney tenderness at the CVA. I'm just going to tell me if you hurt yourself, if this hurts you. No?
No.
Okay. No.
No.
Okay. All right. I need for you to take a deep breath in your lungs and let it go. Expand symmetrically, and you appear to have your ribs are at about 45 degrees of your spine, and you appear to have an elliptical shaped chest with an anterior posterior transverse ratio of about probably 1 to 2. All right, and the first thing that I'm going to do is check you for femoris and bronchophony, and I'm going to do that by feeling the vibrations in the palm of my hands at the base of the fingers. I just need for you to say 99, 99 every time I put my hand on you. Okay?
99, 99, 99, 99, 99, 99, 99, 99.
Okay. And the next thing I'm going to do is to palpate for excursions. And when you were doing that, I did not hear any. I did not perceive to have any consolidation or thickness of tissues in the sounds that you were making. And so now I'm going to get you to take a breath and hold it until I tell you to let it out. Okay, let it out. Okay, now this time I'm going to get you to exhale and don't breathe in for just a second. Ready? Okay. Okay. And I'm going to do the same, relaxed. I'm going to do the same thing on the other side. Okay, take a deep breath and hold it and don't let it out. Okay, let it out. And now, breathe out and don't breathe in for just a second. Okay? And relax. Okay, the next thing I'm going to do is listen to your chest. I'm going to be listening to the vesicular sounds out on the sides, and then I'm going to be listening in the center at the bronchial sounds, bronchial vesicular sounds. Okay, just breathe a little bit deeper than normal. Okay, and relax. And you could scan the room again. And I'm going to get you to lie down. I'm going to cover you up with a sheet. Take that other stuff. And I'm going to kind of tuck this in a little bit so you'll be comfortable. All right. Now, on the back, the bronchial tracheal sounds in the center were more moderate intensity in pitch. On the outside, they were softer and gentle, more gentle. And so, if you could say that same thing, 99, 99.
99, 99, 99, 99, 99, 99.
Okay. And let me listen to your lungs on this side. Just breathe a little bit deeper than normal. And I'm going to listen also in your neck at the tracheal bronchial sounds. Just normal breathing, whatever's normal for you. They're sharper and higher in the neck, which they should be. Just keep breathing. And they're moderate pitch in the center and moderate intensity. And let me listen to the outside. Soft and low on the outside. Okay, now I'm going to keep you covered for this, and I'm going to find your apical impulse. Okay? And I'm going to do that by 1, 2, 3, 5, and I'm moving out to the side. And with one finger pad, heart rate is 76. I'm going to compare that to your carotid. Should be the same. It's regular. And it is the same. The relationship between S1 is the lub of the lub duct. It's actually the closing of the AV valves, whereas the S2, that's heard at the base of the heart, is the closing of the semilunar valves. And this is a much more gentle tap than the sounds that you hear in the neck. And let me check your carotids for bruits. +2, no bruits. And I'm going to look for your external jugular, and I see it on both sides. I'm also going to look for a ventricular heave, a little push at the apex of the heart where I was with the apical impulse, and I see none. I'm going to put my hand on you and see if I feel a vibration or a thrill. And I'm going to look right here. I don't. And I'm going to palpate for the borders of the heart. Okay, I'm going to start on this side. At the second, space, down to the 5th space. And I'm going to do the same thing over here. Keep it covered. Okay? And I'm going to listen to your heart. I'm going to listen at the spaces up here. About the second space, I'm going to start listening for the aortic, the semilunar valves. Erb's point, I'm going to be listening again. And then I'm going to go down here to the apical, to the fifth intercostal space, and then back over here again to left of the sternum for the tricuspid valve. I'm going to listen with both sides of the stethoscope, so if you just give me a minute to do that. And the other side. All right, and I'm going to listen to with the other side of the stethoscope. Okay? Okay? And then I'm going to listen for your aorta. First, let me find it. No hernias in the umbilicus. Color is all symmetrical. I'm listening for bruits in the aorta. And I do not hear none. The rate is regular, 2+. I'm going to listen to your femoral. Regular, 2+, no bruits. Bilaterally, 2+ and regular. And then I'm going to look at your abdomen. Okay. No swelling, no masses. And before I finish that, I want to listen. Hear the presence of vowel sounds bilaterally, pronounced on the right lower quadrant. And okay, and then I'm going to come over here behind the back, and I'm looking for the spleen, and I am unable to palpate the spleen, but I am going to percuss down. Orchodomus, which appears to be right, it changes right after the last rib. The relation, I need to also mention that if I had not heard vowel sounds, I would be listening for 5 minutes by the clock, which would be the standard. And we look at this side also. And I think I feel the tip of her liver, and it's not enlarged. And I'm going to palpate down. Just below the border to the of the rib. All right. I'm going to test your legs a little bit. Can you take your right leg and bring it up like 90 degrees? Any pain? Okay, just put that down. And then your left leg, go ahead and do that. Okay. And I'm going to go ahead and get your pulses. +2 in regular. And that's the popliteal pulses. Dorsal medialis. +2 in regular. Posterior tibial. +2 in regular. I'm going to check your reflexes down here. Negative. Very good. Good ticklish. Okay, and I'm going to just, if you'll relax your leg. Okay, I'm going to check you for the positive Homan sign. I'm going to press back. Any pain? No? And if you could just relax, I'm going to check you for clonus. Just relax this foot and let me have it. Okay, and that would be negative. And while I'm here, I'm going to rotate your hip out to the side and then inward. Okay, and I'm going to palpate your knee. I'm going to move it up and back. No crepitus, no popping, no masses, no swelling. Okay, I'm going to do the same thing over here. Okay, just relax. Relax your knee. Okay. Homan sign is negative. And I'm going to check you for clonus. Just relax. Okay, no problem there. I'm also going to get you to move your knee in alignment. Good alignment. No masses, no crepitus, no popping. I want to make sure I get your foot. All right. And can you take this foot and move it up your shin? Yes. And can you do that with the other foot? Okay. And I'm going to take your temperature. Your feet are only slightly cooler than the rest of you. All right. Tell me if you feel this. Just say now if you feel some touch, okay?
No. No.
Okay?
No.
Okay? All right. I'm going to get you to swing your legs around and sit up. You want to fan around again? Okay. All right. I'm going to check your reflexes in your knees. Okay. 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 Just relax. Just relax your head. Okay. And I'm going to, and that was the Achilles and the patella reflexes. And if you can hold onto this finger and check your dorsal medialis, just relax. I'm sorry, brachial radialis. Okay. All right. Okay. And this is the biceps and the triceps. Okay. And the same thing. Can you hold on to my finger? Maybe this finger would be better. Okay, just try to relax. Okay. All right. Just relax it. Okay. Once again, this is the biceps and then the triceps back here. Just relax. Okay. All right. And I need to check your elbow. Okay. If I can just. No popping, no crepitus, no tenderness. Alignment is good. Proper. Okay. No popping, no crepitus. Okay, I need to get you to squeeze 2 fingers. Okay. Can you turn your hands like this? Okay, and out here. Turn your shoulders out. Yes, and then in. Okay. Can you move your head forward? and backward. Rotate to the side and to the other side. Okay, I have a few other tests because then I'm testing your mobility. So I'm going to move on to some of the cerebellar tests. And so I have a few that I want you to do. One is called graphesphesia. So if you close your eyes, I'm going to draw a number on your hand and you tell me what number that is. Okay? Close your eye. 6. Good. Okay, now I'm going to place something in your hand and you identify it. It's called sterignosis. Okay. All right.
Okay.
And I'm going to place it, close your eyes, and place it in your hand. You tell me what it is. What does it feel like?
Key.
Yes. Very good. Okay, I have a few other things I want you to do. I want you to take each one of your fingers and touch them to your thumb. Right? And I also want you to take your nose and touch. Yes. Okay? And I want you to alternate a little longer. Okay? And then the other thing that I need you to do is to stand up because I need to finish testing your knees. There's an exercise that I couldn't do. Just face the camera. Okay. I want you to do just a little bit of a knee bend. Yes. Okay. And then I want you to lift one leg backward, hyperextend your leg. Yes. And then the other side. Yes. And then I want you to walk heel toe, one foot right after the other. Yes. All right. And I want you to, can you walk on your heels? Excellent. Can you walk on your toes? Okay. All right. Have a seat. All right. Thank you.